Hi everyone, my name is Bolumbele Joffa, and today I'll be talking about my topic exploring the intercommunication of COPD and asthma. So, for my introduction, this topic explores the connection between chronic obstructive pulmonary disease and asthma, highlighting the similarities in risk factors, other health problems, and biological processes. I'd like to start with a definition. COPD is commonly known as chronic obstructive pulmonary disease, which is a lung disease that causes restricted airflow and breathing problems. Well, similarly, asthma is also a lung disease, and it is caused by inflammation of muscle tightening around the airway, which makes breathing hard. Both definitions were from the WHO website. And moving on to the shared risk factors. As we can see, both of them are lung diseases and have similar risk factors such as smoking. Both COPD and asthma are strongly associated with smoking, which includes active smoking and passive smoking as well. The environmental exposures also could increase the risks of contracting these chronic lung diseases, such as pollutants, such as air pollution, chemical irritants, and also allergens in the air that are toxic. Comorbidities involved could be cardiovascular diseases. Both COPD and asthma are associated with increased risk of cardiovascular conditions such as hypertension, coronary artery diseases, and heart failure. It was proven in one of the researches listed below that 2.5% of individuals that suffer from either of these conditions could possibly develop one of the following cardiovascular diseases listed below. We have anxiety and depression. Individuals who also suffer from COPD and asthma are most likely to experience anxiety and depression, which could possibly have further adverse effects on their quality of life and disease management, causing their health to further deteriorate for these reasons. Osteoporosis is also another comorbidity that they both share, which causes a linked increase to risk of osteoporosis and bone fractures, like due to systemic inflations, medication use, and possible inactivity due to the severity of their conditions. We have the pathophysiological mechanisms. We have inflammation. Chronic inflammation plays a central role in both conditions, which in COPD, we have inflammation primarily affecting the small airways, lungs, and the parenchyma, leading to airway remodeling and a limitation of airflow to the lungs. And in asthma, we have the inflammation characterized as infiltration of mast cell activation, resulting in a reversible airflow obstruction. We have the next one as airway hyperresponsiveness. Both conditions involve increased sensitivity of the airway to various stimuli, leading to an exaggerated bronchial constriction and airflow limitation. And we also have airway remodeling. Chronic inflammation of COPD or asthma contributes to structural changes in the airway, including thickening of air walls, mucus hypersecretion, and alternation and smooth muscle tone. These changes further exhibit airflow limitations, contributing to respiratory symptoms. Oxidative stress. Both conditions are characterized by increased oxidative stress resulting from the imbalance between reactive oxygen species, production of antioxidant defenses, antioxidant stress contributing to airway inflammation, muscle production, and tissue damages in COPD as well. Neurogenic inflammation, lastly, both conditions also involve neurogenic inflammation mediated by the release of neuropeptides such as substance P and neurokinin. And in conclusion, I'd like to say that overall, these two conditions have further above been stated by their risk factors, comorbidities, and pathophysiological